name is Emily Onello, and I'm honored to be giving the Rural Health Team Award to our family medicine physician preceptors from Minnesota and Wisconsin who volunteer to teach our medical students from the Duluth campus of the University of Minnesota Medical School. My colleague, Jim Bolger, whom many of you know, celebrated, quote, the powerful impact these physicians have had on our students, unquote. Students in Duluth are placed in rural communities under the tutelage of family physicians for 5 separate weeks during their first 2 years of medical school. The family medicine physician offers to house the student and incorporate her or him into their life as a family physician. With this model, our students gain an excellent and accurate picture of practice and home life of the rural doctor.
The University of Minnesota Duluth, they focus on rural healthcare from the very beginning, from day one of medical school. I was fortunate to participate in the RPAP program, which is a Rural Physician Associate program where we spend 9 months in a rural hospital. And it definitely solidified my calling to rural family medicine. Across the U.S., only about 5 to 7% of physicians practice in rural areas. Of the students who have begun their studies in Duluth and completed their training, 44% practice in communities smaller than 25,000 people, a remarkable standout against the national averages. In the state of Minnesota, a lot of our population lives in a rural area, and we value that. And I really hope that we can continue to value our rural health care so that this huge population that does live in the rural area can continue to receive care at their local hospital. Being in a rural area, it is extremely hard to recruit doctors to come back to these rural areas. It's been extremely rewarding to make such a difference in people's lives, whether it's through delivering a baby or taking care of an entire family or caring for elderly. People are just extremely appreciative, and I've just found that going into medicine has just been a perfect fit for me. Since 1973, the medical school's mission has been and remains to train family and Native American physicians to serve our rural and tribal citizens. Dr. Bolger reminds us to, quote, imagine, if you can, what the effect would be if these physicians had not been willing to help to sacrifice professional and personal time to assure our rural citizens of a competent and satisfied workforce for rural Minnesota, unquote. Thank you, Rural Family Medicine Preceptors, and congratulations on your well-deserved Rural Health Team Award.